Good morning, family and friends, and Happy New Year. We will start the new year off by talking about hypothyroidism because January is Thyroid Awareness Month. Hypothyroidism is the most common type of thyroid disorder, and it arises when your thyroid gland fails to produce enough thyroid hormone. The thyroid gland is described as a small butterfly-shaped gland positioned at the lower front aspect of your neck. Its primary job is to help regulate your metabolism, or simply put, it helps regulate the way your body utilizes energy. For example, it regulates essential bodily functions such as your breathing, heart rate, nervous system, muscle strength, body weight, and body temperature. With hypothyroidism, an inadequate amount of thyroid hormone is produced, and as a result, your bodily functions begin to slow down. This can cause unintentional weight gain and make you always feel tired. Hypothyroidism impacts 5% of Americans, while there is an additional 5% of the population who are unaware that they have this condition. So what causes hypothyroidism? The most common cause of hypothyroidism in the US is Hashimoto's thyroiditis, which is an autoimmune disorder. This means your immune system starts to attack itself. It makes antibodies against the thyroid gland. Like many autoimmune disorders, it is thought to arise because of a combination of genetic and environmental factors. Hypothyroidism is also linked to other autoimmune disorders such as celiac disease, type 2 diabetes, rheumatoid arthritis, and systemic lupus. Other causes of hypothyroidism include treatment for hyperthyroidism, and hyperthyroidism is the production of too much thyroid hormone. When hyperthyroid patients are treated with radioactive iodine or other anti-thyroid medication, their thyroid gland may malfunction and produce inadequate amounts of thyroid hormone. Thyroid surgery or radiation to the head and neck area can cause hypothyroidism. Being deficient in iodine. Your body needs iodine to make thyroid hormone. This is the most common cause of thyroid disorders worldwide. However, it is seen infrequently in the US. And lastly, medications can also be a culprit. One common psychiatric medication is lithium, and another medication is the long-term use of hormonal birth control, typically over 10 years. So who is at risk? Women are at a greater risk than men. 1 in 8 women will develop hypothyroidism in their lifetime. As we age, our risk increases, especially after age 60. And if you have a history of thyroid problems or thyroid surgery, you are at a greater risk. If you have a family history of thyroid problem, that also puts you at a greater risk. Having a history of another autoimmune disorder also may put you at an increased risk. Being pregnant or having had a baby within 6 months can increase your risk as well. Of particular interest, low levels of vitamin D are associated with hypothyroidism. So make sure you know your vitamin D level. So what are the symptoms? Early symptoms are insidious and can include weight gain and fatigue, which can be seen with the normal aging process for some individuals, regardless of your thyroid's health. As a result, you may not realize that these symptoms are due to hypothyroidism. Here's a list of the most common symptoms: fatigue, weight gain, constipation, feeling cold, decreased sweating, dry, thickened skin, dry, thinning hair, a puffy or bloated face, dull facial expressions, droopy eyelids, loss of the outer third of the sides of your eyebrows, hoarseness, slow speech, joint pain and stiffness, muscle weakness, cramps and aches, impaired memory, hand tingling or pain, slowed heart rate, fertility difficulties or menstrual changes, particularly frequent or heavy menstrual periods in women, and possible erectile dysfunction in men, brain fog, memory problems, and depression. Symptoms typically progress gradually over many years, and if left untreated, additional symptoms such as anemia and hearing loss can be seen. It can also lead to goiter, which is the enlargement of the thyroid gland. The thyroid gland swells in an attempt to function properly. This enlargement may lead to difficulties with swallowing and breathing. Other potential complications include a greater risk of heart disease, heart failure, and peripheral neuropathy, which is damage to the peripheral nerves. Women may experience infertility and have a greater risk of having a baby born with a birth defect. Lastly, there is a rare life-threatening condition called myxedema coma that can lead to unconsciousness and death. So be mindful of your body and listen to what it's trying to tell you. Well, that's it for today. I wish you good health and abundant blessings in 2025.